Thank you so much for inviting me here today to talk about COVID-19 and pregnancy. What do we know now? I do have a disclosure. I participated in the Medical Advisory Board and am a site principal investigator for a Pfizer COVID-19 vaccination and pregnancy trial. The objectives today are to describe the anticipated outcomes for individuals with COVID-19 infection during pregnancy or postpartum, and to discuss the available data regarding SARS-CoV-2 vaccination and pregnancy. The first question I'm going to answer today is, do pregnant individuals have a greater risk of severe illness than non-pregnant? These data are from an MMWR report of cases that were submitted to the CDC from January 22nd to October 3rd, 2020. They had about 1.3 million reproductive age females who tested positive for SARS-CoV-2 that were included, and they had data on pregnancy status available for 36% of these reproductive age females. So this is one of the criticisms of these data, is that they just did not know pregnancy status on a large portion of the cohort. But among those with pregnancy status information, 89% were symptomatic, and among those symptomatic females, 5.7% were pregnant. From that data, they looked at risk with pregnancy, and they found that after adjustment for age, comorbidities, and race ethnicity, pregnant women were at increased risk of ICU admission, mechanical ventilation, and death. They also noted that disparities were prevalent, which we've also seen in other literature. And in this data set, Black women, although Black women only represented 14.1% of the cohort, they represented 37% of the deaths overall and 27% of the deaths among pregnant women. We're just going on a whirlwind tour here. So the next question I'm going to answer is, do pregnant patients with COVID-19 have greater risk of complications than those without COVID-19? These data are from a retrospective cohort of all deliveries from April to November, and an all-payer database that encompasses about 20% of the US population. For this study, they identified participants with billing codes, and so specifically billing codes for COVID-19. And their total N was just under 500,000 patients who were hospitalized for childbirth. Among them, 1.6% of them had a COVID-19 diagnostic code. And then they went and looked at those with COVID compared to not COVID. And again, this is just billing code capture. And what you can see is the with COVID group here has about 6,300 people, and the no COVID about 400,000. And you can see that there are increased risks among those who had a pregnancy hospitalization, who had COVID. There was an increased risk of preterm labor, preterm birth, stillbirth, preeclampsia, eclampsia, HELLP syndrome, venous thromboembolism, ICU admission, and need for mechanical ventilation. And those really did, the majority of them, with the exception of eclampsia and stillbirth, hold up in multivariable modeling. Now I'm going to move on a little bit to maternal and neonatal outcomes. I'm going to focus on the study and the work that we've been doing through the National Institute of Child Health and Human Development Maternal Fetal Medicine Units Network GRAVIT study. The MFMU consists of 12 centers and 33 individual hospital sites across the United States. And you can see here we are in Utah, kind of the Lone Rangers in the West here participating in this network. But we began to study COVID and pregnancy very early in the pandemic. The GRAVIT study is continuing to enroll patients because we're looking more globally at the effects of pandemic on pregnancies in general, not just among those who actually contracted SARS-CoV-2. But we did put out some initial data based on the first 1,219 patients that were identified with SARS-CoV-2 who were pregnant or postpartum in the network. Notably, 53% of them were Hispanic, which is a much higher proportion of Hispanic patients than are typically in our studies, again, demonstrating the disparities in acquisition of the SARS-CoV-2. And when we compared people who were asymptomatic with those who had severe or critical COVID-19, we found that severe and critical COVID-19 was associated with an increased risk of hypertensive disorders of pregnancy, so things like preeclampsia and gestational hypertension, cesarean delivery, which is here, and preterm birth. Also, we found the maternal death rate was about 0.3% in our cohort in terms of deaths that were attributable to COVID-19. We eventually concluded, based on this cohort, that severe and critical illness with COVID-19, but not mild or moderate illness with COVID-19, was associated with adverse pregnancy outcomes. So I think these data are important in that we can tell patients that if you are very sick with COVID, that you do have higher risks of all these adverse pregnancy outcomes, hypertension, cesarean, preterm birth. But fortunately, those that had more mild illness, really, we did not see these increased risks of pregnancy, adverse pregnancy outcomes. So I think we can be reassuring to patients who are able to be managed in the outpatient setting because they're not ill. So what about stillbirth? Stillbirth appears to be rare, but has been reported in the setting of maternal critical illness and multi-organ dysfunction. There was an initial limited single hospital UK evaluation that demonstrated increased stillbirth during the pandemic compared to prior to the pandemic. But there was then a subsequent study across the whole UK that demonstrated no increased risk of stillbirth. And just to show you those data of that second study, they're here. And so this is really looking at monthly count of deliveries with a record of stillbirths. So stillbirths over the time period of 2019 with a lead-in to show you the baseline rates, and then 2020 during the pandemic. And then really blocking off this COVID lockdown period here from April to June. And what they saw was no increased incidence of stillbirth. And so they kind of backtracked on this idea that we may be seeing more stillbirths than prior to the pandemic. There is a lot of interest, not surprisingly, in whether COVID-19 can be transmitted vertically. Vertical transmission likely does occur, but it's extraordinarily rare. There are case reports that are very convincing for a case of vertical transmission, but it's certainly not the norm. We do not see it frequently. SARS-CoV-2 RNA has been isolated from the placenta, though, even in cases without fetal infection. We think that's because the placenta expresses the ACE2 receptor. And there are also histopathologic changes. So histopathology does show evidence of placental damage, often even in the absence of a placental infection. But this isn't universal. But we do worry about the offspring of these women that have SARS-CoV-2 and whether it will affect their development in any way, because we are seeing some placental effects, especially in patients who have more severe infections. COVID-19 and preterm birth is another hot topic. There are very mixed data on this, but there were a couple studies that came out early on suggesting that preterm birth was actually decreased during the pandemic. There was a study out of Denmark that demonstrated a reduction in births less than 28 weeks during the pandemic, going from 0.9 per 1,000 to 2.19 per 1,000 pre-pandemic. There was also a study out of the Netherlands that was a single center study showing a decrease in very low birth weight. So another corollary of early birth, demonstrating that it looked like that had gone down. But then there was a UK study showing no difference in preterm births. There is also a United States study from 2 hospitals in Philadelphia looking at pre-pandemic compared to during the pandemic. They had about 9,000 deliveries and about 3,000 of them were during the pandemic. And they similarly saw no difference in preterm birth, 10.5% pre versus 9.5% during, and no differences in stillbirth. So the question is, has the pandemic lowered preterm birth rates? There are some population-based studies that demonstrate a decrease in preterm birth during the pandemic, but there's others that don't. The mechanism for this would be unknown. There was a lot of discussion of whether there are environmental changes or other things that we could identify that perhaps could help us decrease preterm births in the long term. But really, we're not quite ready for that. This needs some further study. The data out there are pretty mixed. And really, there are not any population-based US data at this point. So just briefly touching on COVID-19 and maternal mortality. This is one of the focuses of the NICHD MFMU Gravid study. We're really looking and delving into severe maternal morbidity and mortality during this time, both related to COVID-19 itself, as well as women in general during the pandemic. There are some data out of the US. I told you that in the Gravid study, the MFMU Gravid study, our maternal death rate was 0.3%. These are data from a case series of hospitalized pregnant and postpartum patients with COVID-19 who were admitted to the ICU in 10 different hospitals in New York. 19% of those with severe or critical COVID-19 by the NIH criteria, there are actually classifications for that, were admitted to the ICU. 2 died and 11 were discharged from the hospital, which gave them an overall mortality rate of 0.2%. So very similar to what we found in our study as well. Notably, that doesn't sound that high, but it is certainly much higher than what we expect from other viruses and other pregnancy complications. And so it is certainly still concerning and something that has drawn a lot of attention. I think also we haven't even begun to delve into indirect deaths during this time. We know from early data that emergency department rates really declined about 50% early in the pandemic. And it remains unknown if pregnancy-related deaths secondary to things that would normally bring people to OB emergency services like severe hypertension, stroke, sepsis, and overdose with the stress of the pandemic have increased as well. People are concerned that they may have. And so we've really asked people who do maternal death reviews, like we do here in the state of Utah, to really consider pandemic effects for any deaths that occur in 2020. And so not just thinking about the direct effect of a COVID-19 death, but also indirect effects because of lack of access to care during this time. I felt like it would be important to touch on COVID-19 vaccination. This is certainly where a lot of the science is happening right now related to COVID and pregnancy, and where a lot of the media attention has been. So I think the initial question is just, is vaccination in pregnancy allowed? Under the emergency use authorization for the Pfizer and Moderna vaccine, there's not a restriction based on pregnancy or breastfeeding status. So yes, it is allowed. And all of the guiding organizations related to OB/GYN recommended shared decision-making for mothers with their healthcare providers regarding whether to proceed with vaccination in pregnancy. Initially, this was really hard because there really were not safety data out there, and we are just starting to get safety data for pregnancy because pregnant women were not included in the initial trials. There was just recently a publication that came out in the New England Journal of Medicine with some initial CDC and VAERS data. And so they combined both of these into one paper. There were 221 adverse events that had been reported and 46 cases of spontaneous abortion. There were, and vSafe, which is just the app that people sign up for when they get their vaccination. Hopefully a lot of you did that. There were 35,691 vSafe participants who received the COVID vaccine in pregnancy. So if you remember, if you use that app, it asked, were you pregnant when you got the vaccine? And so they looked at data from December 14th through February 28th of 2021. They found that participants who were pregnant noted that they had headache, myalgias, chills, fever less frequently than that when they were pregnant versus non-pregnant. But pregnant patients did note that they had injection site pain more frequently. There were 3,958 who participated in vSafe pregnancy registry. So CDC reached out to patients who said they were pregnant and asked them for more information about their pregnancy. 827 of them at the time of this publication had completed pregnancies. 14% of them resulted in pregnancy loss, 9% preterm birth, and 3% small for gestational age, and no neonatal deaths. And so despite not having a good comparison group, they can at least compare these two population estimates and did not identify any safety signal. These are all right around or below baseline risks. There are also a lot of news articles recently about COVID antibody transfer from vaccination and pregnancy. There are a number of articles about this. This is the most recent and largest one that I think gives a little bit more detailed data about this. They looked at 122 women who received mRNA vaccines, either Pfizer or Moderna, for SARS-CoV-2. None of them had prior SARS-CoV-2 infection, and they looked at both maternal and cord blood. And what they found is that the earliest neonatal passive immunity that was detected at about 16 days post-vaccine dose number 1, so meaning that 16 days after the mom's first dose of a vaccine, there was detectable antibody in the baby's cord blood, demonstrating the antibodies had crossed the placenta and were protecting the baby. And these are just that data in a little bit more detail, showing you weeks elapsed since dose 1. And these darker ones are cases in which there's passive immunity. So it's in that 2 to 3 weeks after the first dose that the babies start to get protection from moms. And not surprisingly, there was really nice correlation between maternal levels of antibody and neonatal levels of antibody. So that a lot of patients have seen this and are excited to think about the fact that they may also be offering some protection to the neonate. So I'm going to wrap it up there. I feel like that was a complete whirlwind tour, but it's a short time. I'm very happy to take any questions. I do want to thank the Eunice Kennedy Shriver NICHD for funding the MFMU Gravid study that I spoke about with you today, as well as their ongoing funding for COVID studies in general. So thank you so much, and I look forward to your questions.